exactly. Thank you so much for explaining a bit your situation, how you felt with your eating disorder, and how this affected also how doctors portrayed your operation, how you felt about it. Overall, what message would you like to transmit to others, and how this could maybe help others to maybe, like, how do you think your emotions, or maybe like the way you deal with positivity or negativity, how does this, do you think?
That maybe if you feel bad, try to ask some help, because I think it's important. And once you're going to realize that you're going to be like that for all your life, and the people that could accept you like that, that's fantastic. And the people that not accept that, just say bye-bye.
Exactly.
Is the only thing. But for the people that invite your life, or the professionals that you need to go or wherever, they need to be more patient, or they need to think about how to say things in this topic, because it's not, for example, as in the other person, because maybe you are a part of your problem with the food or your the eating problem, you're going to have a mental problem.
Exactly.
So you have both problems. So they need to carry about how they
care about both, and be careful with how they use their language, right?
Yeah.
How do you think they should use language? They should listen to the patient, or do you think they should just try and be positive about it?
I think maybe they don't have to be positive, because of course if you, in my case it's not a problem, because right now I'm weighing 64 kilos.
Yes.
Yeah. But, and I when I see myself in the mirror, I feel bad, because I see my tummy, I see my legs that are not the idealistic legs or tummy or wherever. And if I feel bad, maybe they are not going to see as bad as I can see myself.
Yes.
But you need to help me, as I weigh 100 kilos, and the people that have that weight, just be patient with them and try to help them to
understand that.
Yeah, and do things specifically for that person.
Yeah.
To help him or her or whatever. Just a specific for him, to see the results in a shorter period.
Yeah.
Not just give government sheets of paper
with the diets.
With the normal diet for everybody, because it's the same as the body shapes. Not everybody is the same, so to eat, not everybody is going to eat the same, in the same quantity, and the same products, or the same.
Everyone's got different metabolisms too, so we have to take care of every single person as an individual and not as a society.
And if the person needs more help than just to eat, they need some treatments or whatever, maybe if you can't provide them, talk about them.
Yes.
If you would like to do it, for example, you can do that type of treatment. It's going to be costly, but it's going to use for you.
Yes.
Things like that.
Exactly.
And the people maybe, because if you do a process and if you start seeing yourself better and better and better, and the people is like telling you, oh, you look better, but you realize that you feel that you're looking better, not because the people are telling you you're looking better. I think mental problems would be reduced.
Yes.
And for me, it's worse.
Especially eating disorders, right?
Yeah, for me it's better. It's worse to have mental problem than an eating
disorder.
Both are important, but an eating disorder,
Well, an eating disorder
You
is
can-
also
you-
related with the mental.
because you can cure that, or I don't know how to say it, because in one time or in another one you can control it, but the
Yes.
mental one, no.
So they're both related, and you're saying that they need to be really careful with how they use their language, because it can also affect not only the eating disorder, but the mental way in which you see yourself, right?
Yeah.
Well, thank you so much for this, and hope everything goes well. And thank you.